as usual, sir, your name, designation, topic, content, and thank you.
Sure. Hi, good morning, Kauvery Hospital viewers. Welcome to this live Instagram view. My name is Dr. G. Balamurli. I'm a spine and neurosurgeon heading the spine department at Kauvery Hospital, Chennai. I hope you're all having a good day. The reason for this Instagram live today is we are celebrating September 5th as International Spinal Cord Injuries Day. I want to explain to you in the next 15-20 minutes why this day is being celebrated worldwide, what is the reason for this awareness, and what are we going to achieve out of this. We all know that we have so many days, Mother's Day, Father's Day, Sister's Day, and so many other problems have specific days. And this is for us to think about, ponder, and come to some kind of an understanding about what exactly is happening. Who are the ones who are being recognized? Who do we need to bring awareness to, and what is it for? So let me explain to you about the problem. If any of you don't know what exactly the functions of the spinal cord are, let me explain that to you first. The brain is like the motherboard of a computer, which processes everything that happens in our body. The brain has an extension which is called the spinal cord. So the spinal cord really is necessary to execute all the functions of the brain. So, for example, if I want to lift my hand, my brain thinks, the signals go through the spinal cord, it comes to my hand, and I'm able to do this. If I have to feel and tell you what exactly it feels like, it's hot, cold, rough surface, then there is sensation that goes through the spine, into the spinal cord, into the brain, and it interprets what that is. So there are so many functions that the spinal cord does, which includes movement, sensation, passing urine, passing toilet, breathing, bowel movements, sexual function, and so many other things. So if this spinal cord does not function, nothing functions. So you may be aware, you may be awake, you may be conscious, but you will not be able to function. You can be bedridden, you can be wheelchair bound, and you can be permanently disabled forever. So isn't it not important that we need to protect the spinal cord? So that is why we want to create this awareness about Spinal Cord Injuries Day. Now, spinal cord injury is very, very common in our country. A lot of you may think that, I'm not going to get it. I may not, need to know about this. I may not need to worry about this. But I tell you, it is just if you're in the wrong place at the wrong time, and it's a fraction of a second that accidents happen. I'll tell you where accidents happen mostly. Commonest place for spinal cord injuries are on roads, road traffic accidents. It's usually two-wheelers, pedestrians, pillion riders, cars, and anything else. But the most common is two-wheelers. So you may be just a good driver, but you don't know if somebody else is driving well on the road. You don't know where there are pit holes. You don't know how you can suddenly just skid off and on a rainy day and fall down. And all these can change your life in a second. The minute you have an injury, the minute there is a damage to the spinal cord, everything stops functioning. And there's nothing in this world right now that's available to fix the spinal cord injury. The second common place is falls. The falls can be at your workplace. There are so many construction sites that we see everywhere. People fall off almost every day in somewhere or the other. People work like, people who climb trees, coconut vendors, people who are painters who are painting on walls. So there are so many places that people can fall down from. You can have a fun jump from your first floor or just jump down 10 steps. So many other adventure things we do which we can get injured. And the other thing is people fall at homes, elderly people in the toilet, slip and fall. You trip and fall somewhere. So falls are the second most commonest cause. The other causes of spine injury or spine damage are due to infections like TB, which is very common, severe disc bulge, severe spinal cord compression from various problems. But those are much, much smaller. So it's very important that you have to be careful about road accidents and other things. Now, the next thing is what happens if you have such an injury? Let me tell you some few first aid tips when you see somebody on a road or somewhere who have a spinal cord injury. Say you're driving somewhere and you see an accident involved with a car and a two-wheeler, the people lying on the road. Our instincts is really to go and help them. And what we do is we go, you wake them up, you make them to sit up, you sometimes give them water. You want to, try to do something to help them. But I tell you, you have to suspect the spinal cord injury in every person on a road accident. A small fracture in the spine, which is very stable, can be made unstable and you can worsen the problem. In case you go, you ask them to stand, you ask them to sit up, or you try to, turn them around or get them out of a car or get them out of an accident scene. So it's very important that you actually try to call ambulance, a private ambulance or 108, and you ask them to come and let them assess the paramedics, let them shift them very carefully onto a stretcher and let them shift to a hospital. And you have to have a high index of suspicion of spinal cord injury. So this is what is my tip for first aid if you suspect somebody. And who do you suspect? If somebody is not moving his legs or hands, if somebody is complaining of pain in his neck or spine, or if somebody cannot feel his hands and legs, then you have a very high suspicion that, oh, this could be a spinal cord injured. 40% of people who have spinal cord injury also have a serious brain injury. So they may be in coma. So if anybody is in coma, anybody is in an accident, you consider almost always that they have a brain and spine injury and do not move them, call the ambulance. So what happens in hospital? They come, we examine, we do a scan, we find out where this injury is. And usually these injuries are associated with a fracture of the bone. If there is a fracture of the bone, that may need to be fixed with some rods, screws, and a decompression. So we may have to do an emergency operation. And that is why it's important these kind of injuries should go to in a higher center where there is trauma facility. Moving them to a smaller hospital is okay for first aid, but if the patient is reasonably stable, should be shifted to a bigger hospital, whether it's government or private or wherever. The reason for that is if a patient goes to a small hospital, you move them around, you do not have the facilities for scan, you do not have a full-time neurosurgeon or spine surgeon. Some doctor who is not aware of these things can see them, things can go wrong. And by shifting them multiple times in multiple ambulances to different hospitals, to different scan centers, because the smaller hospitals may not have a scan center, this causes a major risk of causing more damage. So you have to be careful that such injuries should go to a bigger hospital. So once this happens, most of the times they may need an operation, and the operation only fixes their spine. It does not fix the spinal cord, which is actually a very, very important structure which runs from the base of the skull all the way up to the lower back. So this is a long structure, and anywhere it can get damaged. It can get damaged here, here, or here. If it gets damaged here in the neck, everything below that will not work. If it happens here, everything below this will not work. So it depends on which level of injury that, the survival, the outcome, what they can do in life varies. So now once, you have an operation, you fix the spine, the spinal cord injury is still there, but the bone is fixed, and they are then ready to do what? Most times these patients end up going home. What can they do at home? Imagine if somebody has an injury at this level. Their hands are fine, but they cannot sit, they don't have feelings, they cannot walk, they do not have any sensation in the leg, they cannot pass urine, they cannot pass toilet. How are they going to manage them? Who is going to manage them? So these are all the various things that we need to remember. Now imagine a young 25-year-old, ambitious with lots of dreams, working on a two-wheeler, is running around everywhere for work, suddenly is involved in an accident, and the next day you go and tell him that, excuse me, you're not going to be able to walk from tomorrow. So this is a very devastating situation for the patient, for the family, for everybody around. It's not just a problem for the patient himself. It is a huge financial burden and psychological burden to the family, to the economy, to the society, and to the country. So who is more prone to these injuries? There's a statistics in India which says that about 80 to 90% are young men between the age group of 20 to 40. They are the only earning members of the family. They have a young family. And because of this, there is a huge economic burden because 80% of them are the middle and low income group. So this is a serious problem for the country. Do you not think that this problem needs an awareness? Do you not think that this problem is only in India? This is an international, worldwide problem because accidents happen everywhere. Unfortunately, India is number one on road accidents for the head and the spine. So we have a huge number of 10 to 15,000 patients every year who are involved in accidents, who are paralyzed, and whose life changes in a second. And that is why this day is there for an awareness about why spinal cord injuries should be recognized and why we should be very careful about this. Now, the next half of my discussion is going to be in terms of what happens. Okay, how is their life going to be after a spinal cord injury? What happens to them? So these patients should be subject to rehabilitation. Now in Kauvery Hospital, we have a rehabilitation center called Hamsa Spine and Brain Rehab, which is the first of its kind in our country, in Chennai, where it's dedicated inpatient center with 20 beds, and now we have 3 other branches as well, where we provide rehabilitation for patients with spinal cord injury. Now this spinal cord injury, as I said, requires a lot of care. It's a teamwork. It's a huge teamwork of specialists, doctors, rehab physician, nurses, physiotherapist, occupational therapist, speech therapist, psychologist, and dietitian to improve your diet, peer counselors who are there to motivate you, and so many other people who need to work together over a period of 3 to 6 months in order to give you a good outcome. Imagine, as I said, a 25-year-old is told that he's not going to walk, he cannot work, he cannot go on a two-wheeler again. What do you do? So you need to put them through this rehabilitation program. So there, the entire team focuses on what are his goals. What was his job before? Was he in an IT sector? Can he go back to that job? Was he a manual laborer? He cannot go back to his old job. So we try even vocational training. We teach them new skills, new jobs. The intention of rehabilitation is to try to make them as normal as possible, is to try to get them to a livelihood which they can live, where they can earn, where they can have an social atmosphere, a good psychological status of mind for him and his family. So this is what rehabilitation is focused. So we have immediate goals, midterm goals, long-term goals. So we try to work towards these goals, in trying to train them. So depending on the level of injury, sometimes they can walk with special calipers and special shoes. Sometimes they may not be able to walk. And slowly over a period of time, you can get them to do certain activities. If, for example, somebody has an injury lower down, they can still walk. They can walk with a special shoe, with a special caliper, and various other things. Now, if somebody is not able to walk, then he probably will need to be on a wheelchair. He needs to learn wheelchair skills, how to go to a cinema, how to go to a mall, how to go do shopping. And now there are so many advancements in wheelchairs and motorized wheelchairs and motorized scooters which can be attached to wheelchairs. There's so many things that are advanced where the whole idea is that we want to include you into the community, to get them back into society, to make them an earning member of society so he can take care of himself. Because this 25-year-old is still going to have to grow old, may need to have a family, may need to get married, may need to have children. So we teach them about how sexuality can happen, how they can have children, how intercourse can happen. So when all these things are so complicated in life, the only person and the only team that can help you is a rehabilitation center. So you must try and approach a rehabilitation center anywhere you get access to, and be able to make use of the best use of them in order to come to a normal life. So these are some of the complex issues, because you have to live, this 25-year-old has to live for his rest of his life. He's going to get old, he's going to have hypertension, blood pressure, old age, osteoporosis. How are they going to survive? Complications are for life. You can get bed sores at any point because they're sitting on the wheelchair a lot, they're not able to walk. They have to pass a catheter to take the urine out every 4 hours. So they have to make sure they don't get urinary infection. Because they're using frequent catheterization, they can develop kidney stones, bladder stones. We have to check their kidneys and bladders once a year. Their bones get very weaker very quickly. So if you break a bone, they will not know it. They will not have any pain. So even if you pour hot water on them, they may burn the leg, but they will not have any pain or sensation. So all these complications have to be avoided for life. So in order to do that, you need to be educated, and that's what rehabilitation centers do. And imagine this 25 who has all his dreams shattered, his marriage in the pipeline, which is not going to happen. So imagine the mental status of this patient. So they need a lot of motivation. They need a lot of peer support. They need a psychological counseling. They need a lot of motivation to get them back, get them out of this. People do not accept that they're not going to work. So this can be all education can happen at the rehab center with the doctors, with the therapists, and the entire team of people. So do you not think that this is an important, a serious problem that we need to bring about awareness? And as I said, this is very common in youngsters, in young people in their 20s, 30s, and 40s, the workforce of our country, the future of our country. So this awareness should start from school and colleges. Because you see that, there are people who are on the road, and sometimes they don't follow rules. So how do you prevent spinal cord injury? So prevention of spinal cord injury is safety. It's all about safety, safety, and safety. When you're on the road, make sure that you wear a helmet, you protect your head as well. In a car, you wear your seat belt, you don't drink and drive, you're not using your mobile phone, you're respecting the rules, red lights, pedestrians, and also you make sure that you drive slowly, safely, and speed is the thrill, but it kills as well. The next thing is at workplace, it is the responsibility of both the people working as well as the employers. For a construction site, the construction companies should take care of safety of their employees. You have to make sure that they wear the proper gear. You make sure that you have safety during their workplace, or any work, whether it's a painter or a coconut vendor or whoever is doing the job. You make sure that they are all safe. So these are all the safety things you can take, and it's a problem that we all have to face. You cannot blame the government. You cannot blame anybody. So we all have to take responsibility in protecting yourself, because as I quote this to a lot of people in a lot of places. When you buy a mobile phone, the first thing that we all do when we buy a mobile phone is you buy a protective cover, and then you buy a glass that protects your screen. When you give so much of importance to your mobile phone, why can't you protect yourself by wearing a helmet? After all, it's your head, it's not anybody's head. Do you really need a regulation and rules to say that you have to wear a helmet? Does the policeman have to remind you that you're not wearing a helmet? It is your head you're protecting. So it's very important that we take care of ourselves. I hope that this information was very useful, because it's a very serious problem. And do not think that you are not prone to this, you will not be affected. Accidents happen everywhere, accidents happen all the time. And if you are in it, this is what you need to understand. That surgery is important, a good hospital is important, rehabilitation is essential, and there's a lot of peer supports and NGOs and groups that will be there to help you to come out of this and to sustain for life. You can still have a very good life, and you've seen in the Paralympics that how many of our disabled people on wheelchair who have won so many medals for our country. So you can go up to that extreme and have a very normal life. So your life does not end if you have a spinal cord injury. And we at Hamsa and Kauvery Hospital are here to guide you and are here to take you through this journey throughout your life as to how you can cope and survive. Thank you very much, and I'm going to answer a few questions that have been asked. Is there any way to keep your spine healthy? Yeah, so this is a much more a common question. The only way to keep your spine healthy in a young age is to be active. So being active is the most important thing. If you are overweight, if you are a smoker, if you are sedentary, if you do not have any of these, if you don't keep your health well, you are going to be prone to developing problems at old age. So a young, healthy spine is going to keep your old age better. So being active is the key to a healthy spine. How is the spinal cord protected? The spinal cord is actually protected by the vertebra. So there are bones which you can feel in your back. So this bone actually protects your spinal cord. But if this bone fractures, the bone can compress and press on your spinal cord. So it is very important that you try and make sure that you protect your spinal cord. Are massages good for the back and spine? Yes, massages are good for the back, but they're only temporary. So having a massage when you have a severe back pain is good, but it's not going to cure your back problems. Most people, they come with back pain, they come to me and they say, doctor, I've been doing massage, I want some tablets, but they're not ready to change their lifestyle, they're not ready to lose weight, they're not ready to be active. So if you have back pain and back problems, the commonest thing that you have to do is to be as active as you can and be healthy. So the only way to be healthy is to be active. By just not doing any activity and expecting your back pain to go, it's not going to happen. Does back cracking injury injure the spine, or does it help? I don't think back cracking is something that is going to injure your spine. I'm not sure whether you're asking in the context of when doing a massage or trying to move your back, you hear some noises. This is very common. This is due to wear and tear. With age, you develop these problems. Noises in your back and cracking in your back you will have. But I don't think that that's got anything to do with injury. Injury happens with high velocity, with the fall, with a significant other problems. So I think we have answered quite a lot of our questions that we have done, and I hope that you had a lot of things clarified. So once again, I just want to thank all the viewers here and those who are going to view this. Remember, your spine is very important. Without your spine, you cannot function. You have one life, one spine. And if the spine injury happens, it can be a devastating injury for life. The spinal problems that you can face because of spinal cord injury are for life. And this could be very serious. So I kindly request you to take care of your spine, because you don't want to be in a wheelchair for the rest of your life because of some carelessness and that minute that you were not safe. Enjoy your day. And the other important thing I also want to say is that when we see people with disabilities, when we see people on wheelchairs, we all tend to look at them and have sympathy and empathy. But I don't think these people need that. They need a lot of motivation. If you're an employer, you can employ people in your work who have disability, because people with disability feel that they are not part of the society. They're not included by society, whether it's by the government or the private or the work system or by the society. So we need to be more empathetic, and we need to be more understanding to include them. They are normal people like us. And just because they had a spinal cord injury, it doesn't make them less privileged for being in the society. So I thank you again and have a wonderful day. Goodbye.